Okay, hey everybody, this is Alex with Care Conscious, and today we're talking about the big two residential options that are on a lot of people's minds, especially family caregivers, and that is skilled nursing facilities, nursing homes, and assisted living facilities. And I'm talking about it with Dr. Ann Glass of the Institute of Gerontology at University of Georgia. So, diving right in, what are the big differences between nursing homes and assisted living facilities?
Well, it really has to do with your activities of daily living or those of your loved one. And those activities include bathing, dressing, toileting, transferring, that is like getting out of bed, indoor mobility, and eating. And if you or your loved one needs help with just a few of those, then assisted living would be a good match. However, if you get to a point where you need help with all of those or most of those, then you might need to consider a nursing home.
Okay. So what are the trends today? What are we seeing in terms of who's going to nursing homes, who's going to assisted living facilities, and why?
Well, it's actually kind of surprising because we've seen a decrease in the number of people in nursing homes in recent years,
Really?
in the last few decades. And you wouldn't expect that because we know the number of older people is increasing, but it's really due to the rise of assisted living as an option and also to the increasing availability of home and community-based services. And we know people would like to stay at home, and so if they can access the service and it's enough to be able to stay at home, they'll choose to do that.
Right. And when considering assisted living, Medicare is not going to pay for that.
No. And really you might as well plan on paying for that out of your pocket.
Right.
And it's an appealing option to most people because they see it as being able to be a little bit more independent and all, but sometimes it becomes a problem because their level of dependency gets to the point that they really need to be in a nursing home, and the assisted living can't meet their needs anymore.
Okay. So say we're moving on to the point where we do need to consider nursing home. We've heard a lot of kind of negative stuff about nursing homes in the past decade or two. How much of that is founded, and what's the real picture of the nursing homes today?
Well, there are a lot of very good nursing homes out there, and in most homes the staff are really well-intentioned and they're trying to do a good job. The quality still varies, however, and it's really on the family's responsibility to kind of keep up with what's going on in the nursing home.
Right.
So if you have a family member who's in a nursing home, it's really, really important to go visit them regularly and different times of the day. People will get better care if the staff knows that they've got family coming in, and you can see for yourself how things are going. At the same time, it's good to build relationships with the staff so that you can work together to provide the best possible care for your loved one. And additionally, I would encourage you to do things for the staff to show your appreciation, because they have one of the toughest jobs. The aides who work in nursing homes have one of the toughest jobs in the world, and they don't get paid enough, and that's why we have some problems in nursing homes. One of the issues is the turnover in the staff. So anything you can do to work well with your staff would be great.
Okay. And finally, say my mother is in assisted living or nursing home. If I suspect there is abuse or neglect, what are the key things to key me into, hey, something's not right?
Well, if your mother is showing some signs of fear or increased confusion or things like that, and that could have to do with a lot of different things. It could be medications and all, but it could be that she's getting too much medication or not enough medication. It's not being given properly. But to get to, if you really think there's something wrong, like your mother's developing bed sores, for example, you might try talking to the staff and the director of nursing, the administrator if you need to, but also there's a resource for family caregivers. That's a long-term care ombudsman. Okay. And that's someone you can talk to if you are concerned about the care that's being given in a nursing home or assisted living.
How do you get in touch with the ombudsman?
Typically, you could contact the Area Agency on Aging, and they would put you in touch with the ombudsman for your area.
Great. Well, thanks, Dr. Glass, and thank you for tuning in. See you next time. you.